When taking Rolapitant tablet, it is important to note that it is used in combination with other medications to prevent delayed nausea and vomiting caused by cancer drug treatment, also known as chemotherapy. Rolapitant works by blocking a natural substance in the body that triggers vomiting. It is important to follow the recommended dosage and timing for this medication to achieve its optimal benefits. It is also important to note that this medication is not recommended for children under 2 years old due to the risk of serious side effects. Before taking Rolapitant tablet, it's important to read the patient information leaflet from your pharmacist. Take this medication as directed by your doctor, usually within 2 hours before chemotherapy. This medication should not be taken more often than once every 2 weeks. If you experience nausea or vomiting, be sure to inform your doctor. If you experience stomach upset or mouth sores while taking Rolapitant tablet, it's important to inform your doctor or pharmacist. However, it's important to remember that the benefits of this medication outweigh the potential side effects for most people. Serious allergic reactions are rare, but if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. Be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. As for the best time to take this medication and the daily dosage, it's important to follow your doctor's instructions. Before taking Rolapitant tablet, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist. Additionally, make sure to inform your doctor or pharmacist about your medical history before using this medication. If you have any upcoming surgery, it's crucial to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication if it is clearly needed and discuss the potential risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this drug passes into breast milk. When taking Rolapitant tablet, it's important to follow the dosage instructions provided by your doctor. Be sure to take it at the optimal time recommended by your healthcare provider. When taking Rolapitant tablet, it's important to be aware of potential drug interactions. This means that other medications you are taking could be affected by Rolapitant, or vice versa. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential issues. For example, Rolapitant can slow down the removal of other medications from your body, which can affect how they work. This effect can last for 4 weeks or longer after taking Rolapitant. Some examples of affected drugs include dextromethorphan, pimozide, and thioridazine. On the other hand, other medications can affect the removal of Rolapitant from your body, which may also affect how Rolapitant works. Some examples of these medications include rifamycins, such as rifampin and rifabutin. It's important to talk to your doctor about any potential drug interactions before taking Rolapitant, and to follow their guidance on the best time to take this medication and the appropriate dosage for your specific condition. If you or someone else has taken too much of this medication and experienced severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. This medication is used to prevent nausea and vomiting caused by cancer chemotherapy. It is also used to prevent nausea and vomiting after surgery. This medication works by blocking the action of a certain natural substance in the brain, substance P, that causes nausea and vomiting. Make sure to take each dose of the Rolapitant tablet as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for guidance on when to take the next dose. Make sure to store your Rolapitant tablets at room temperature, away from light and moisture. It's important to keep them in a safe place where children and pets can't reach them. When it comes to getting rid of any unused or expired medication, don't flush them down the toilet or pour them into a drain. Instead, consult with your pharmacist or local waste disposal company to properly discard them. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.